The future of Pakistan's healthcare. My name is Kelly Bowers, and I'm going to discuss the future of Pakistan's healthcare. Because the people in Pakistan are not educated consistently, and because healthcare has not been made a priority in the government's budget, healthcare in Pakistan will not improve at the current state. The people of Pakistan are suffering and struggling to survive in the present environment. The creation of Pakistan was not very well planned in regard to organization and making sure they got started on the right foot. The massive migration of people into the country that was not prepared to take them made life in the new country of Pakistan difficult to begin with. The fact that the division was to help separate feuding religions meant the focus was on separating the Hindu and Muslim people rather than creating a country. Peace is essential in a country, but the focus of religious separation meant that the plans for government leadership, infrastructure, economic issues, social issues, and health issues, and many others were not dealt with effectively. The quality of an individual's health determines the quality of their life. If a large portion of a population is unhealthy because of inadequate health care, the population will suffer. Without good health, people cannot contribute to society, which in turn affects the economy of the country. The lack of adequate quality health care in Pakistan is a big disadvantage to the country. Pakistan is a country struggling to be successful. Many of the reasons for the struggles are due to political, military, and religious unrest. This has created a difficult environment to work together to resolve the issues of the healthcare crisis there. The suppression of a proper education for their citizens, both men and women, is a big reason the country is failing, especially in good healthcare. Educating individuals is part of the problem in Pakistan. It is hard to have good health care if people have not been educated to give it. There are 0.81 doctors per 1,000 people. That is less than 1 doctor per 1,000 people compared to 2.3 doctors per 1,000 people in the United States. The lack of opportunity for education is a real problem. It is hard to know how to take care of oneself or family if someone is not adequately taught. The dominion of the extremist groups and parts of the government that are corrupt are only hindering the development of this struggling country. Malala's dreams and wishes to learn and become something through books and education seem strange to the people in the United States who receive an education starting at age 5. As Malala stated, if Christians, Hindus, or Jews are really our enemies, as so many say, why are we Muslims fighting with each other? Our people have become misguided. They think their greatest concern is defending Islam and are being led astray by those like the Taliban who have deliberately misinterpreted the Quran. We should focus on practical issues. We have so many people in our country who are illiterate, and many women have no education at all. We live in a place where schools are blown up. Healthcare in Pakistan has never been a priority. The infant mortality rate in Pakistan is 66 per 1,000 births, and in the United States it is 5.9. Maternal mortality rate in Pakistan is 170 per 100,000 live births compared to 23.8 in the United States. Life expectancy for men is 65 years in Pakistan compared to 76 in the United States. The Pakistani government pays a little over one-third of the total healthcare expenditures, leaving the Pakistan citizens to take care of the bulk of it through private healthcare. This might not be so bad, except the cost of food, housing, and others is so high, and in general the people of Pakistan do not make a lot of money. They must decide between food and shelter or healthcare. The amount of money spent on healthcare by the government is part of the problem as well. Governmental provisioning of the healthcare has been deteriorating during the last decade or so and has resulted in dissatisfaction pushing people to opt for private care. As a result, the poor remain disadvantaged, and such a skewed use of healthcare funds has contributed towards a rise in poverty. Pakistan spends 0.2% of its GDP in the health sector, while individuals spend 61.5% of their money on healthcare. This lack of funding also results in people seeking health care they can afford. When faced with the stress of trying to find help for a loved one who is ill, people may turn to sources that aren't qualified to provide the necessary care because they can't afford a qualified physician. In desperation, individuals search for anything that would help their loved one. Malala talked about her aunt who suddenly passed away. She wasn't even 50 years old. She was diabetic and had seen a TV ad for a doctor in Lahore with some miracle treatment and persuaded my uncle to take her there. We don't know what the doctor injected her with, but she went into shock and died. My father said the doctor was a charlatan, and this is why we needed to keep struggling against ignorance. In order to have access to adequate health care, the Pakistani government must first take steps to increase funding for educating their people. Physicians, nurses, and the many other healthcare workers must be trained and taught in order to have that resource available for the people of Pakistan. This education has to start at a young age and must be offered to everyone. The general public need to have a basic education, and opportunities for further education to train for higher degrees must be allowed to those who desire it. The government of Pakistan also needs to spend money on healthcare. In 2007, Pakistan spent 3.48% of its government spending on public health, compared to the United States spending 19.45%. Pakistan only has 0.7 hospital beds per 1,000 people, compared to the United States, who has 3.3 beds. Healthcare is not inexpensive. It is an investment. But when you understand the importance of such an investment, it should become a priority. Having a good quality of life results in a population of people who can provide other services and resources. Without good health, so many negative effects are produced. In order for Pakistan to improve the healthcare and quality of life for their citizens, education of all has to begin. This education will provide a more promising life in general and will individually influence the people there in so many ways. An improvement in healthcare will also benefit the economy and improve the poverty conditions that exist there. Pakistan must also invest money and resources into their healthcare system for it to prosper and improve. By providing a quality education and investing in the healthcare system, the government of Pakistan will reap many benefits in their economy and with the people who live there.